I'll let you know when the recording has started. Okay, you're on.
Cool. You want me to speak now?
Yeah, go for it.
Okay. Again, I'm Sean. So I also, to keep it entertaining, I have Carly looking at the chat. I'll ask a few questions so she can send you some freebies, and also send maybe a pocket mask, maybe like a little CPR keychain thing. So if you don't have one of these little CPR keychains or pocket masks, you should keep them near you or in your car. But I always have on my keychains, a couple different keychains, so you can always do CPR if you're going to do breaths. Basically, just so you know, for CPR, if you are in charge of them, like at school, you're supposed to be doing CPR and using a barrier device, giving breaths, and getting the AED. If you don't know the person, you're on the side of the road, you're at someone's house hanging out, you can call 911 and you can do compressions, and maybe someone else can do the breaths if they want to. Always try to get a barrier device if you can, but it's your choice. You don't have to give breaths. But if it's a loved one, if it's your grandma, if it's someone in your family, especially if they went in the pool or drown, you know, people in Florida are like, well, I don't have a pool, I don't have this, but people die in canals all the time, and people fall in hot tubs, people fall in regular tubs. So it's very important to also do breaths. So don't think you shouldn't just do breaths. You should do compressions, but also don't forget about doing breaths, especially if they've been out for a long time, dead for a long time, or if they drowned, okay? So if you do have something at home, such as a pillow or a football or a medicine ball or a foam roller or anything, you can push on that. If you forgot or you're in your car right now, just try today, just push on something somewhat hard. So that'll lead to my first question. So if you can't say it out loud, you can only chat. So sorry if you don't have a typewriter, if you can text next to you, but is it good or bad to break a rib? So if you put good or bad in the chat, whoever does it first will get the first free prize. Good or bad to break a rib doing CPR? So whoever types good or bad, whatever the correct one is, might get something free from Miss Carly. And she'll keep track of that. So it's actually good if you do a little bit of cracking or breaking. It's like spraining an ankle, so you could sprain the cartilage. You could break it. Now, you don't want it to destroy, okay? You don't want to destroy someone's chest and be like, yay, I broke all their ribs, okay? But if you hear a crack or a break or a snap, crackle, pop, that's actually okay. If they're very old or elderly person, a lot of times they're going to crack too. So for them, you'd actually almost do like a child. You'd be using one hand, especially if they're like a thinner elderly person. But for a lot of people, even these kids that are 9, 10, 12 years old, right? They're a kid. Well, when LeBron James was 11 years old, he was bigger than most of us, right? So we want to use 2 hands on a lot of these kids these days. Okay, even elementary schools, a lot of these kids would get 2 hands. But if they're a smaller kid or someone elderly, you would want to use 1 hand, okay? So I'll go right into compressions, is what we're talking about, hands only today. So if you want to follow along with me on a pillow or a medicine ball or whatever, or I'll show you on my little mannequin, okay? So I have my little alien mannequin. I have Carlos here. He has his Philadelphia Eagles on because I'm from Philly. And then I have my little baby here, which I'll talk about later. So these are real ones. We can also push on something around the house. So I'll do that first. All right. My second question. If you know this, the compression to breaths ratio, if you're taking a real class, or if you know the person, if it's your mom or kid, what is the correct compressions to breath ratio? I did not say it yet, but if you put in the chat box, what is the compressions to breaths ratio, what you should do? Oh, I see Alma typing. I think she knows it. Miss Charlene's not sure. Did anybody get it, Miss Carly?
We have a few people answered here.
All right, I'll wait for a few more and I'll tell you the answer. Whoever's closest, whoever got it, gets it. So in the meantime, in about 10 more seconds, football, medicine ball, pillow, if you want to get that, or just do it tonight. If you're embarrassed to do it now or don't have it with you. All right, the correct is 30 compressions to 2 breaths. So you're supposed to give 30 compressions and then 2 breaths, okay? If you took this a long time ago, it used to be 5 to 1 when I first learned this. it was 5-1 and then 15-2. But it's 30 compressions, 2 breaths, okay? So you guys are gonna watch me, and then after this, I'll play a quick video, okay? Can you see me on the ground okay, Miss Carly?
Yes.
Okay, so if you were taking care of an individual, you would tap and shout, not like, hey, hey, hey. You'd actually knock them, or if you want to do a sternal rub. So you go like this, hey, hey, you okay, you okay? Or do a sternal rub. Actually rub on there, okay? If you see a sign of life, if they open their eyes, moan, groan, if they talk, if they're moving, they don't need CPR. Maybe they were knocked out, maybe they're diabetic, maybe they had a drug overdose, maybe something's going wrong, but they don't need CPR. But if they don't look good, and no matter what skin color you are, okay? This is like alien white. No matter what skin color you are, if you look at the lips, if it's not looking good, you want to go right to calling 911, telling someone to get the AD, and do 30 compressions. If there's blood over the face, you don't know them, just do compressions only, okay? So we'll do compression only first. So if I was by myself, they don't look good, I would put my phone, 911, put it down, I would call and I would put it on speakerphone, and I would go right to the center of the chest, basically between the nipples, but the center of the chest, and you're gonna push down 30 times over and over and get 2 breaths, or you're just gonna keep doing this, and when you get tired, okay, I'm gonna take a little break and go back to this. But notice how my arms are straight and I'm pushing straight over the mannequin, correct? If I do this, I got my butt, it's not gonna do good. So I need to be up off my bottom, use my straight arms and push down 30 times, or push over and over and over and over, okay? Or I do 30 times, good. 30 times, hard and fast. If someone can type in how far down we're supposed to go, you get the next prize. How many inches are you supposed to push down on the chest for an adult or a large child? How many inches are you supposed to push down on an adult or child?
And Sean, while we're waiting for that answer, we had one question come through. He said, I thought we were not supposed to do breaths anymore unless there were 2 people available.
Yeah, no, you do 30 compressions, 2 breaths by yourself. So you do 30 compressions, and then you get to 2 breaths. 30 compressions, 2 breaths. If there's 2 people, for example, Carly would be on this side, I would be here. When I get to 30, I stop, and then Carly gives 2 breaths. Breathe, breathe, and I go right back to compressions. 27, 28, 29, 30. Breathe, breathe, and I go right back to compressions. If you're not going to get breaths, if you're by yourself and you don't have a barrier device, then you just keep doing hands-only CPR over and over and over. You called 911 or someone else called 911, and you got to keep doing this until you see a sign of life. Remember, a sign of life is talking, moving, moaning, groaning, opening eyes, moving around. So you're supposed to push down 2 inches. That's the answer. You're supposed to push down 2 inches. If you hear a crack or a break, that's okay. All right, I'm gonna try to present this video. Hope it's not too laggy. So this is like 1 minute and 10 seconds or something like that, okay?
Suddenly collapse, it's important to act fast. Helping to save a life is easier than you might think. Just start hands-only CPR. The first step is to send someone to call 911 or call 911 yourself. Then get directly over the victim. Put the heel of one hand in the center of the chest, then put your other hand on top of the first. Then push hard and fast in the center of the chest until help arrives. It's important to push, giving 100 to 120 compressions per minute, which is about the same tempo as the song Stayin' Alive. Let's hope you never have to use hands-only CPR. But if you see a teen or adult suddenly collapse, don't be afraid to try it. Remember, call 911, then push hard and fast in the center of the chest until help arrives. Your actions can help save a life.
All right. So you saw that? That was pretty quick. Does anybody, I'm not done, but I'm saying, does anybody have any questions right now at this point? Like I said, I'm not done yet, but any questions? No? Am I okay to keep going, Miss Carly?
Yes.
Okay. All right. So that was talking about hands only. So if you do nothing, think of this. If you do nothing, I see Phyllis is watching me nicely. If you do nothing, they stay dead. So just always think, oh, I don't want to hurt them. A lot of people say, I don't want to hurt their lungs. I don't want to hurt their chest. Well, if you do nothing and they are almost dead or dead, they go to the funeral and nothing's wrong with their dead lungs and nothing's wrong with their chest. I would rather try to save them. If you do push on someone too hard, and if they did show a sign of life, good. I'd rather have that, because some people will do nothing and then the person dies. So please always try to at least tap and shout, call 911, give compressions. So usually someone else takes over, or another teacher, a school nurse, or the athletic trainer, or a nurse, or whatever takes over, and let them take over. But if you start, you get the oxygen start going to the brain. So the main thing, a lot of times, some people survive CPR, but they're brain damaged. We don't want to have brain damage, okay? So the next question is, at what time or how many minutes does brain damage start? So is it 1, 2, 3, 4, 5, 6? So put in the chat box, at what time does brain damage start? 1 minute, 2 minutes, 3 minutes, 4 minutes, 5 minutes, 6 minutes? So it's one of those answers.
While we're waiting for that answer to come in, I think that Ludmila had a question. I think she's asking, is there a circumstance where the person doing the CPR could get hurt? I think that's what she's asking.
Okay. Physically, well, I mean, you can get hurt. People on the side of 95 try to do help, and then they get hit. Even paramedics and cops get hit all the time on 95. I mean, you can get hurt that way. It's basically, there's still statistically like no chance. They used to, before coronavirus, people worried about getting AIDS, but there's been like one maybe case in all of CPR's history of someone getting it. Could you maybe possibly get herpes at some point from doing it? That is a super slim, slight possibility, but AIDS people always used to worry about. That's not a problem with CPR. Coronavirus now, I'll just bring that up. So basically, if you were doing CPR on someone, all they want you to do is leave the person's mask on. Like I see Phyllis has her mask on. So you just leave the mask on, they can still breathe through it. So when you're pushing out, when you push on someone's chest, just think if I wouldn't do that, but if I punch someone on the chest, some air comes out. So when you're pushing on someone's chest in CPR, air, okay, whether they're alive or almost alive or dead, air is still coming out of their mouth. So you would use like a little cloth or some type of barrier or material, just put it over their face, not like suffocating them, but basically so it's covering their mouth, just like you have a mask on right now, or a gaiter or whatever it may be. Or flip their shirt up to there. So it would be covering as you're pushing there, so it's not going out in the air. I mean, it's about the only thing you'd have to worry about. But also, I'll also say this, but the Good Samaritan law protects you. So don't be afraid to do CPR. People can try and sue you. They can sue for anything. It says hot coffee or caution contents are hot when you buy McDonald's coffee. Why? Because someone sued them because they put it in their lap. So they can try and sue you, but they won't be successful. So never be scared to do CPR because they won't be successful, because the Good Samaritan law does protect you. It also protects you if you use the AD, whether you're trained or untrained. So if you're scared to use it, just go get the AD. If you're scared to do CPR, at least you're moving people out of the way. Calling 911, maybe you know the person's name, get their information on paper or whatever. But if no one else is around, please try and start doing compressions. Some compressions are better than nothing. Okay. All right, let me show you.
That was actually a good point to bring up. But she was also asking about the person needing medical assistance. You talked about the cracked ribs, which is not a bad thing. Is it, but is there anything else? I guess she's saying that you could do to hurt them.
No. I mean, if you destroy the ribs, but this is the thing. If they're dead, you bring them back to life, they might have broken ribs or a punctured lung, but at least they're breathing, at least they're alive. If you just put your hands like this or just pray and go, oh my gosh, I hope they're okay, and they die, they're going to stay dead. So we'd rather you always try something than nothing. And you can always call 911. You can say, hey, I called 911. They said start doing compressions. I started doing compressions, to make yourself to feel better about that.
Okay, and what about, do you do a clean sweep of the mouth prior to compressions?
Yeah, you can. It also depends on your skill level, but yeah, you can look in. If you see that piece of chicken, take it out. But basically, they don't want you to do it like I'll search for it. So basically, if they're in a chicken wing eating contest and they fell on the floor, and you know that they went on the floor, maybe they were choking first, then you take out that chicken, right? But most of the time, it's just hurry up and get to it. Because again, if I'm pushing, I'll show you this real quick. This is an infant. You can even listen a little bit. When I'm pushing on the chest, what's coming out? Air. So sometimes it's forcing some stuff out too. Just like on a grown man, if I'm pushing two hands, it's going to force out and help the unblock airway a little bit as well. Okay. All right. So real quick, again, if you ever try this at home today, you do 30 compressions on the ball or whatever it may be, hard and fast, 2 inches. You're going all the way to 30. If you need to take a break and go back to 30. If you know the individual, or if you have a face mask or a barrier device, like I said, if you have the pocket mask, if you have a CPR keychain, you take that out and then you put it on the face and give 2 1-second breaths. Tilt the head, pinch the nose, and you would give 2 1-second breaths. Breathe, breathe, look for the chest rise, and go back to 30 compressions. Remember, I'm straight over the person, straight hands, I'm using my body weight. If I hear a crack or break, who cares? If they make faces, if they moan, groan, if they say, ow, 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 oh, I stop. Sorry, I thought you were dead, Carlos. Okay? But most of the time, nothing's going to happen. I keep going here. If they started to cough, if they started, like on TV, stuff's coming out of their mouth, turn them to the side or turn their head to the side. Are you okay? Are you okay? Are you, oh, go right back to compressions. Just because they throw up does not mean they're alive, because you've been pushing and breathing for a long time. So 30, and then 2 breaths. Remember, pinch your nose. Breathe. Breathe. 30 compressions. Or, like I said, if you don't have a mask, just keep doing hands-only CPR over and over until someone else, or sometimes you're doing it, the mom comes, and the mom gives breaths, and you do compressions. So let the mom worry about giving breaths, and you worry about doing compressions, okay? Also, the AED is very important. Make sure you know where your AED is at school. On the pads, it shows you exactly where to put it. I have to say my own house, but the pads show you exactly where to put it. So it's upper right, lower left. So make sure you look at the pads on the AED where you work. It's pretty self-explanatory of where to put it. And the first thing you do on any AED, just like your phone or computer,
begin by removing all clothing from the patient's chest. Cut clothing if needed.
Okay, turn it on. It starts telling you what to do. Never be afraid to use the AED because it will only shock if needed. It will not shock someone who doesn't need it. So don't be afraid to use the AED. Okay? All right, I'm going to show you this next video. It's like a minute and a half. It's a video from my class like 2 years ago. It's at a gym, so it might be helpful to some of you who are like in preschool or PE teachers. But basically, you'll see it's like an open setting, and I made them do a whole scenario of how to handle it. So you guys can watch this, like a minute and 30 seconds. That's it. So they do 2-person CPR and use the AED.
Someone remove all clothing from patient's chest. Do you want me to turn it on there? The red handle to open bag. Okay, ready? Clear? Do not touch patient.
of you.
Provide chest compression and rescue breath.
Good. Head pinch nose.
Okay, I stopped it because it was getting a little bit glitchy right there. But basically, you saw them working as a team. Someone was giving 30 compressions. Someone was giving 2 breaths. They put the pads on the bare chest, okay? And they kept going. Never take the pads off. Once you put the pads on, keep going, okay? And the main thing is starting this, because if you start compressions, even without breaths, it starts getting the oxygenated blood. And like I said, you don't want the person to be brain dead. If you do nothing, once you get to 4 minutes, that's the answer. Once you get past 4 minutes, that's when brain damage starts. When you get to 5 minutes, 10% more of the brain cells die, and the percentage of death goes up 10% more each minute. So once you get to past 10 minutes, the success rate is extremely low to survive CPR. But if you start CPR and AED within the first 4 minutes, it's a very high chance of survival if they haven't had many previous sudden cardiac arrest or heart attack or predisposed problems. But basically, if someone, it's the first time ever they've had this issue, if you start CPR and get the AED within 4 minutes, it's a way higher success rate than if you do nothing after 6, 7, 8 minutes or they are predisposed. Okay. All right. Like I told you, the Good Samaritan law protects you. Cracking the ribs is okay. Dial 911 as soon as you can. If your school says, well, we have to call the radio, and then someone on the radio calls 911, who cares really? You want to do that too, but just use your phone or call 911, because if it takes a minute or two, that might be a minute or two that you're eating away at the person's life. So call as soon as you can. And then I'll show you infants after this real quick. All right, any questions, everybody, anyone?
I think we're up to date here.
Okay?
Yep.
Okay, I'll talk about infants and show you infants, and then I'll be done. You guys can ask questions. I forget, most of you have seen that old school movie, Mrs. Doubtfire, or Miss Doubtfire, whatever. You know, you're doing the Heimlich maneuver, and it comes out, boom, it does come out like that, okay? It is pretty cool. So Heimlich maneuver, you can sort of do it to yourself. Doesn't feel good. If you are ever choking at home, a non-rolly chair, so don't use a computer chair, you're gonna roll down the street, right? So you want to use some other type of chair if you were choking, and you do it to yourself over and over until it comes out, okay? If it was an infant, this is like 1 and under. If this was an infant, then we would go like this, 5 times. Turn them over and push right here 5 times. 5 times, hard too, right? 1, 2, 3, 4, 5. So we're not burping the baby. We want to get this out. So it's pretty hard back slaps, then hard pushes, like CPR like this. Okay. So also CPR on infants. If it's a child, you use 1 hand. So this is adult, everybody. This is adult. A smaller, thin, young child is 1 hand, about 1.5 inches deep. And an infant, they changed it. You can do 1 hand or 2 or 3 fingers. So they just changed that last month. So you can do 1 hand on an infant like this, or 2 or 3 fingers. That's how I used to do it, or I used to like this. And you still do 30 times. So if it's an infant, you could also, even if it was like, let's say a 6-week-old, you could be holding the baby and going like this. 1, 2, 3. The only good thing about infant CPR is you can walk with it if you had to walk to the front door for the ambulance to come. So same thing, 30 compressions, 2 breaths. Most of you would say, oh, I'll give that baby breaths. Yes, most people would. So if you give this baby breaths though, adults, we pinch a nose and make a good seal. The baby is so small, if they're very small, we put our mouth over the nose and mouth. So we would give 2 puffs, and go right back to 30 compressions. Now you don't hold the baby like this. I'm doing it because we're on Zoom, but you know. So we do 30 times. Once we get to 30, 2 breaths. If you don't know the baby, just do compression only. You can do one hand, or you can do 2 or 3 fingers. 30 compressions. Over and over until you see a sign of life. Sign of life, again, is moaning, groaning, talking, sitting up, okay, sign of life. If they are not responding at all and they don't look good, no matter what skin color you are, if you look at the lips, it's not normal color. If you think to yourself, oh my gosh, this does not look good, you need to keep doing CPR until the color comes back and then they have a sign of life, okay? All right.
What is the inches to push on for an infant?
What's that?
What are the inches to push on for an infant?
Oh, so adults it's 2 to 2.4. So like I try to think as a teacher. So think for adults, 2 hands, 2 inches or more. For a child, it's 1 hand, it's about 1.5 inches. So you know, adults is this, a child is this, and so is an infant. So infant is actually about 1.5 inches also. So it's, people think it's like a millimeter. No, we're not doing millimeter, okay? We're doing about 1.5 inches, so it's still pretty far. So adult, 2 inches, and infant and child is about 1.5 inches, but technically you can also say 2/3 the depth of the chest, okay? So if you look at the child, or I'm sorry, infant, if you look at the infant, 2/3 the depth of the chest. Okay, my kid's crawling through the video. One right here. Okay. Any questions? Oh, this is real quick as we're talking. This is very important. You know, it's a sad statistic. 80%. This is in Florida, but you know, across America, but especially because Florida has so much water. 80% of children and infants die from drowning are in front of the mom, the dad, the aunt, or the uncle. So it's pretty crazy because what happens is, you know, a lot of times, like I'm watching, but now, you know, people are on your iPad, you're on your phone, or you know, like, oh, my pool is small. And then they walk inside for a minute, but the kid hit his head. Doesn't matter how good you swim, they can drown. Or like I live in a lake, you can go in the lake, fall off the pool, fall in a hot tub. I know an infant that drowned. They opened up the hot tub, and then the hot tub slammed on their face, and then they couldn't find them. The baby was there for a couple hours inside the hot tub, okay? People driving down Pahokee and Southern, people go in the canals, and it happened again like a week or 2 ago. They drowned in the canals right there too, okay? Either you can't get out or don't know how to swim, you're in your car, or it tips sideways. And then the other kids are in there too, and then they can drown that way also. So it's good to know CPR, not just for school, of course. Anywhere you go, you can help save someone's life. You can't make it worse, okay? Unless you do something super crazy, but basically, you can't make them more deader. That's my little joke right there, right? You can't make them more deader, so you can only make it a little bit better, okay? And Carly, I'll mail you a couple of these in the pony too, a little keychain thing and a mask, and I'll let you pick random people maybe. But inside the keychain thing is a one-way valve, so you always feel comfortable doing CPR, hopefully giving breaths, or give it to the person next to you and let them do breaths and you do compressions.
Okay, perfect. And we do have 4 winners today for answering your questions, so.
Cool.
That's too.
So your homework is make sure you do compressions on something, but your other homework is know where the AED is, and then make sure you look at it. Because some people go, I know where it is, and you don't know. So know where the AED is at your school or facility, or even if you go to Publix, it's right where you walk in. If you go to Planet Fitness, it's usually on the right when you walk in. I go to Planet Fitness. But LA Fitness, things like that. So it's more common than you think. So when you do CPR, you're supposed to say, hey, you call 911, Alma, call 911. Carmine, go get the AD. So you're supposed to be saying, that's somebody. Okay, you're supposed to be calling people out. Or red shirt, you do this. Pink shirt, go get this. And another thing is, like at schools, always send someone, or luckily you have cops there all the time now, but always send someone, go open the gate, or tell the cop, hey, go open the gate, because sometimes, you know, things are locked all the time. You don't want to be like, woo, 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 we're here. So make sure gates are opened so the fire rescue can come, or the nurse, whoever's coming, can come right for that area.